My medication's working great, but do I have to stay on it forever? So, this is by far the most common question I get from my patients regarding medications to help optimize their weight. And unfortunately, it's not really a simple yes or no answer. First of all, you should really only stay on a medication as long as it's not causing significant, persistent, long term side effects and it's helping you. So, how do we determine if it's effective? Well, most clinical trials would consider a 5% body weight loss over about a 3-month period at the treatment dose to be successful. So, if you found a medication that seems to be working well for you and is helping you optimize your weight, the key point to remember is that all medications that treat obesity are designed to be taken long term. As I've explained in previous videos, obesity is a complex chronic disease and there's no quick fix or cure for it. Medications to treat obesity don't permanently change your genetics or your hormones. It's kind of like taking a medication to lower your blood pressure for a short period of time and then stopping it and expecting your blood pressure to be normal for the rest of your life. Indeed, studies show that when people come off their obesity medication, the majority of them regain the weight they lost. Now, that said, it doesn't mean every single person regains weight, and you may not regain the amount of weight that you did lose. So, what I tell my patients is this: you can safely stop your obesity medication at any time. None of the medications approved by Health Canada for weight loss need to be tapered off gradually. Sometimes you might get sick and feel unwell and not want to take your medication, or you go on vacation and forget it at home and you're not able to take it for a few weeks. And that's okay. Conversely, if you want to intentionally stop your medication, we can try coming off it and see what happens. So when I have a patient suggest this at an appointment, we come up with a plan and then we schedule a follow-up for a month or two and see how they do. It's kind of like an experiment. Let's see how you do coming off the medication, because we can always restart it. Or for some of my other patients, when they've reached their weight loss goal and they're in the maintenance phase, sometimes we try backing off on the dose of their medication, especially if they don't have extended health coverage, because this can help save them money. So really, the bottom line is yes, these medications are designed to be taken long-term for a chronic disease. But it's also safe and okay to put them on hold and just see what happens. Just don't be disappointed if you regain weight. It's not your fault. Talk to an obesity medicine doctor like me to come up with a feasible long-term treatment plan.